Hi, welcome back to Rohrich Knows Podcast, helping you become a better and more informed you. I'm Dr. Rod Rohrich from Dallas, Texas. Let's talk about the best facelifts for you and really demystifying the deep plane facelift. And let's take a deep dive into the deep plane and facelifting. You know, facelifting has not changed a lot in many, many years, and then when it does, it kind of goes full circle. We've done facelifts where we've gone down almost to the bone, and now we're coming back, and now we're back in the deep plane. So you know, just remember that the goal of plastic surgery, especially great plastic surgery, is to be invisible. And that's the theme of 2025. And the goal also is to be in the face protection, not witness protection program as plastic surgeons, because we want people to look normal. And you want to improve on the normal and make them look natural, not weird. So what are the options? And these are all these things that people talk about. You know, mini facelifts, and then the SMAS facelift, the deep plane, and then the deep lift, the deep plane lift and fill facelift. So let's take all of these one at a time. And I always hear about, you know, when is it ready? When are you ready to have a facelift? Well, you're ready to have a facelift when you're looking like a patient like this that has jowls and platysmal banding and is sagging of her malar areas. This lady would benefit from a facelift. And look, one side is different than the other. That's called normal. You know, one side is always more asymmetric. Her left eye is bigger than her right eye. That's normal. You're never going to be able to change that. You'll be able to improve it, make it look more natural, but you're never going to get total symmetry. Symmetry should not be the aim. The aim is to refining the symmetry of youthfulness. So let's look at the mini facelift. Anytime you see a surgery where the person says mini, be careful. Mini tummy tuck, what is that? I mean, is that, you know, a tummy tuck done by a small surgeon or a mini? I mean, no. A mini facelift, I don't really know what that is either. Other than, you know, maybe it's a minimal surgery done with skin laxity and you're only pulling the skin. I personally don't like these terms, so I don't like to do mini anything. And usually if you're just doing a little mini skin lift, you know, it's sure, I see patients saying, oh, but my surgery took an hour and I look great. Yes, for about 3 to 4 months, because skin lifts are not an option, I don't think. It shouldn't be done. So what about the other realistic options, the SMAS facelift and the deep plane? Well, you know, the SMAS facelift is the cornerstone of which all others are based upon, and that's the deeper layer facelift. And both the SMAS and the deep plane are deeper layer facelifts. In other words, you are adjusting the deep layers to aging, and it's a comprehensive way to get good long-term results. Now, the deep plane facelift is certainly nothing new. It just has a resurgence again in social media, and the quote-unquote advantages that it potentially has natural results with dramatic rejuvenation, well, that's not been shown. They certainly look good early on, but do they really lift structures better and longer? Can't really tell, and also there's no data to support that at all. Now, a combination procedure that I've been doing for almost 20 years is really a deeper plane or deeper layer lift and fill facelift, and that really uses the power of a deep plane lift on the outer structure and the mobile SMAS with central facial fat grafting. Because remember, you can pull any plane on the outer aspect, but you never can fix the central part, and that you need to fix with selective fat augmentation. And that's really customizing a patient to look as good as they can based upon their appearance preoperatively. And also look at what the patient looked like 10 years earlier, because you can probably improve somebody 10 or 15 years, because you have to consider things like elasticity, you know, the subtlety of the results, and then how do you consider that, and then why is a facelift in a younger age better? I think it is better because your skin is younger, it heals faster, you get subtle but more powerful results, and it does prevent deeper wrinkling. So, and if you wait too long, I mean, what is too long? I mean, I've done facelifts in 78 even 80-year-old patients with secondaries. The key is the results aren't quite as good because the skin is thinner and the elasticity is not as good. But so I think the timing is, if you have jowls, like I mentioned, and sagging of your lower face, and I think those are the most important things to look for. And every face is unique. And the power of doing a lift and fill deep layer facelift is that you can customize it. And that's the key. You have to customize it based upon your ability to understand facial aging. And the cornerstone of that is fat grafting and the deep layer facelift. Those are the two game changers in facelift surgery today, by far. Fat grafting and understanding how the human ages. We described this in 2007, and I think that's really important because fat compartments transformed the modern facelifts. And you can say a sign of youthfulness is that beautiful fullness that you see, and then fat loss with aging, you can see on the right, and that's a game changer. So fat compartments and how you eject each of these fat compartments is so critical. You can see in this transformation of this patient, doing selective fat augmentation with a deep layer facelift is transformational. So how do we age? We lose deep malar fat with that structural support, and then when we do that, fat loss, it predicts aging. And so when you see that, you get restoration of that with central facial fat augmentation with a deep layer outer facelift. So that's the science behind facial aging. And you have to understand that science, that as we age and lose fat, we have to restore it. And the key is the central facial fat reshaping, so that you go from a triangle of youth to a square of agedness. And that is what you want to rejuvenate, and you want to restore that triangle of youth. And so when you have a patient like this, you want to take her and reshape her square look and make her more angular and shapely. And that's really what you want. And the understanding of how facial aging occurs is so critical. So you can take a patient like this, and you can do central facial fat augmentation, and you can reshape the central face, bring up the cheek area, soften it, reshape it, and really give you the cornerstone of a deep layer facelift, lifting and filling and using the power of both. So filling centrally and lifting on the outer layer. And I think that's so important. It's not just how you graft, it's where you graft and the type of grafting you do. So you go really deep grafting with larger fat that you harvest, and then the superficial fat is done in the superficial layers. And you have to apply all of these individually. That's so critical because everybody's asymmetric. Look at the power of how this patient's face is so asymmetric, and yet that's a normal event. That's just how we are. So long-term observations are, you look better if you have your facelift done at a younger age, and obviously the more attractive, the better result. A full neck has a higher relapse rate. A full face has more longevity. And when you open the neck, you have a less of a relapse rate. And interestingly, males and females have a similar revision rate, although I think the males have a higher revision rate of the neck. And then anybody time you do a skin resurfacing, they look better. And peels or laser resurfacing. And of course, everyone's on a retinol, and they always look better. Minimally invasive brow lifts. And the cornerstone is everybody with central facial fat compartment augmentation looks better and looks more natural. You can see that in these patients with deep malar fat augmentation and a male and a revision. These are all harder patients, harder cases. Long-term follow-up, 6 years, 4 years, they look better. That's the most important thing. So the key is you want a natural look, don't overdo it, less is more. Operate on people that are nice, give them a great jawline and a neck contour. They're all done under general, they all get preoperative medications, antibiotics, tranexamic acid. We keep them normotensive, we keep them safe in the operating room. They have the same staff, same OR routine. It's a 15-step sequence for doing the procedure. They all stay in our post-recovery unit for 2 days, and then they're seen by myself twice a day, dressing change at day 2, and then I see them every 3 to 4 days till they're completely healed, and they stay in Dallas 10 to 12 days. And really, they all get medical grade skincare, lymphatic massages, scar cream, postoperative visits are all scheduled. And really the cornerstone of it is the deep anatomy. You're doing a deep layer facelift, SMAS versus a deep plane. They all start at the same area in that junction between the fixed and mobile SMAS. And so the key is you have to release all these ligaments, and that's what's so important in the deeper layer facelift, because all of these are deeper layer facelift, from the SMAS to the deep plane, the high SMAS. They all begin at the same area. The deep plane just extends more medially, and is that really needed? I would tell you that it's not where you start, but where you finish that counts. So they're either a deep plane medial or a laterally based SMAS, and I propose something that's a laterally based SMAS. I think the longevity has been shown to be really similar, and I think it's safer. And there's no level of superiority on the results of a medial or laterally based facelift. And I think that's really the most powerful thing, is that experienced surgeons get good results no matter what technique they use. So this is an example of a preoperative SMAS planning, a square full face versus a full face. And so you have a patient with a real full face. This is a SMASectomy and a central facial fat augmentation with powerful neck shaping. And of course you can see here she is, several years post-op, and you got nice shaping of her face and neck area, very powerful lift. And then you have a very thinner face, a thin square face with SMAS stacking, and you're doing a similar thing, but you're actually stacking the SMAS and doing central facial fat augmentation. All these things really have shown the test of time. Here she is at 3 years, and here she is again after central facial fat augmentation. Very, very powerful technique to use. And then another patient, preoperative lift and fill facelift, very thin face. So she had a 15-month post-op central facial fat augmentation with blepharoplasty, and she looks fantastic. And she also looks very natural, very youthful, and I think that's really what you want to achieve in these types of patients, is a youthful, natural look, not a distorted look. And here's another patient that had a facelift with a rhinoplasty. She's only 6 weeks post-op, similar type of things, lift and fill facelift, and just shaping and contouring, beautiful jawline, shaping of that, really neck contouring is excellent. And that's the kind of look you want. You want a youthful, natural appearing look to your nose, to your face, and your jawline. Another example of a lift and fill facelift. These are all long-term results. You don't see that in patients on Instagram. You see them at 2 weeks, 2 months, 3 months, 6 months. This is a 3-year follow-up on a lift and fill central facial fat augmentation, deep layer facelift, shaping and contouring, really nice. And here's 11-year follow-up on a deep layer facelift, with selective fat grafting, and here she is animating. And yes, she is 11 years post-op, and she has some skin laxity, and she would benefit from a neck rejuvenation, but she really still loves her result, as do I. Here's her eyes, 11 years post-op. Here's her face, 11 years post-op. You can see she's got still good shaping, contouring. She has some neck laxity at 11 years, but still overall much more rejuvenated looking face and neck, really powerful technique. Again, 11 years post-op. You don't see that on Instagram. You don't see that on social media. This is a very powerful procedure. So long-term results matter. Deep layer facelifts matter. Central facial fat grafting matters. Excellent jawline and malar shaping and neck contouring lasts a long time. And so which is more important, the deep layer or the fat grafting? I say both are very powerful and very important. And that's what you want to aim for. You want to find a surgeon who's an expert in the science of aging, who's an expert in delivering consistent, reproducible results in facial rejuvenation that are natural and long-lasting and give you the results that you want based upon a precise analysis of your customized aging, and give you a process that's reproducible and consistent. So remember, you fill centrally and you lift the deep layer on the outer aspect, and that is the cornerstone for correction of facial aging. So the key is you want to demystify the deep layer facelift. follow the patient, customize your facelift based upon the aging of the patient, and use a deep layer outer facelift with central facial fat grafting. So remember, be safe, be versatile, give consistent long-term results, and customize your facial rejuvenation to how that patient ages. So give me your thoughts, give me your comments, and until next time, stay safe, stay informed.